Morning, good afternoon, everyone. Thank you all for joining this webinar on gender responsive and disability inclusive social protection systems in Africa, hosted by Transform with support of socialprotection.org. I see people are coming in, so I'm just going to give a few minutes for people to join us, and then we can start. Thanks everyone for joining. Warm welcome. Let's start. My name is Nienke Raad. I work as coordinator for the Transform initiative in Lusaka, Zambia. I'm happy to see so many of you online today to discuss with us on the topic of gender responsive and disability inclusive social protection systems in Africa. But before we go any further, I want to point you to the translation that's available in this webinar. It's in French and Portuguese, and there's a button at the lower end of your screen where you can connect. So please do, if you would like to see this session or listen to this session in Portuguese or French. So in today's session, which is hosted by Transform, we're going to discuss our revised base documents, which have been edited to include gender responsive and disability inclusive guidance for our Transform members, our master trainers, and we want to have a conversation with you on these topics. But before going into the program any further, I just wanted to quickly share a few introductory notes on Transform. For those who don't know Transform, it's an interagency initiative on capacity building, leadership and management of social protection floors in Africa and the Arab region. Here you see our features. We have a regional orientation. It's very important. We started in 2016 with Transform Africa, and in 2021, the initiative was extended to the Arab region. We aim to provide peer-to-peer learning, so all our master trainers are actually experts from the region who are training in the region. Our pedagogical approach is very dynamic, very interactive, moving away from passive learning into active learning and creating that interaction, building on the knowledge that is in the room. And we target social protection practitioners who actually work with social protection on a day-to-day basis. We have a modular curriculum, which will come back today in our sessions. And we are an interagency initiative of like-minded social protection practitioners and member agencies coming together to promote social protection learning. Next slide, please. So just to show you quickly what are the building blocks that we make use of under Transform. This is just a quick overview. We're going to go into them more in detail, and especially what it means for all these building blocks to be more gender and disability inclusive. Next slide, please. Finally, I wanted to give thanks before starting to our advisory group in Africa. This webinar is specifically focused on Africa. And these are all our members, our supporters, our funders. So thank you so much. I think we can go on to the topic of the day. So what prompted Transform to look more deeply into this topic of gender and disability. I think over the years, we have seen that there is a growing demand on mechanisms addressing vulnerabilities across the life cycle. And recognizing this gap, the Transform Advisory Group recommended the revision of the learning modules with explicit focus on gender responsive and disability inclusive social protection systems, ensuring that our practitioners, our trainees are capacitated with inclusive social protection principles and tools. This meant that a few years ago, with the support of UNICEF office, but also our whole Transform community, we worked with Presto, a policy analysis and research firm, which includes leading experts on inclusive social protection, to undertake a revision of the Transform base documents, which serve as the foundation of our learning package. And as mentioned, we received dedicated support from our Transform communities, from the different members, the different experts in Africa and across the globe. And we really look back at the truly participatory and inclusive approach to redesigning our materials. And thank you so much for those who are here for that support. So this webinar, kindly organized with socialprotection.org, which is one of our key members, marks the formal launch, as I said, of these enhanced materials, and really is for you, our members, our community, our master trainers, to give an overview of the improvements that we made. And of course, we hope you will use them in your daily work across the region. Even more so, we want to have a conversation on this topic about driving change and transformation towards gender responsive and disability inclusive social protection systems in Africa, and providing that insight of inclusivity in the different building blocks and understanding the barriers and the solutions, giving a few country examples, giving a few practical examples. And we want to hear from you, of course, after our presenters have given their presentation. So who are you meeting today in this webinar? I'm very happy to introduce to you 4 excellent speakers. You see them here on the screen. You will first hear from Taylor Spadafora, who is a social protection specialist in the UNICEF Eastern and Southern Africa Regional Office. And she provides technical support to 21 UNICEF country offices on social protection, policy, programming, evaluation, shock responsive social protection, and emergency cash transfers. And before joining the regional office, Taylor worked with UNICEF at country level in Malawi, Somalia, Ghana, and Mozambique. And a key focus of her career has been supporting government systems, and especially design of social cash transfer programs, inclusive social protection, evidence-informed policy and decision-making, financing, and linking social protection to other sectors. And Taylor holds a Master of Public Health from the Boston University. Taylor was also the chair during the time that these revisions were being done under Transform. So thank you, Taylor, so much for being here today and for celebrating this finalization and the launch of the base documents with us. We also have Tia Palermo here and Morgan Banks, who both work with Policy Research Solutions, Presto, who were the ones that supported us in making these revisions. Taylor is an associate professor at the University of Buffalo, and her research examines impact of social protection, including gender responsive social protection, on economic security, health, and well-being. She has a lot of experience providing technical assistance on social protection to a wide range of partners and promoting social protection. She has also worked for UNICEF in the past and served as a consultant under the STAR facility. And she served also as a co-principal investigator on studies for the Transfer Project and is a member of the Cash Transfer and Intimate Partner Violence Research Collaborative. She holds a PhD in public policy and a master's in economics. Morgan Banks is a senior researcher with Presto and an associate professor also at the International Centre for Evidence in Disability at the London School of Hygiene and Tropical Medicine. Her research focuses on disability, poverty, and extra costs of disability, which we will surely get back to in our presentations. The role of inclusive social protection in improved well-being and financial security for persons with disabilities. She has provided technical assistance for governments, organizations of persons with disability, and UN agencies on disability inclusive social protection. And she holds a PhD specifically focused on disability and social protection. Welcome, Morgan and Tia. They will speak about the research that Presto did for Transform, and really will go into the mechanisms ensuring that inclusion. So really happy to have you here today. Our final speaker, I'm not sure if she's on, I see that she has joined us now, that's Mrs. Agatha Banda. Very happy that she's here. Madame Banda, she works as a director for the Zambia Agency for Persons with Disability, a quasi-government institution which is in charge of planning, regulating, and coordinating services for persons with a disability. She has a degree in education from a bachelor's degree, from the University of Zambia, and worked in the civil society sector and research academia for 18 years before joining the disability sector in 2020. Thanks so much, Agatha, also for joining us, and she will share with us a bit more on the Zambia journey towards specifically, in this case, disability inclusive social protection systems, and what has been done in Zambia and what still lies ahead. So yeah, I'm really excited to go into the presentations. The webinar is set up so that we have these three presentations in total, and I'm going to ask you as attendees to put your questions, any questions that might come up during the presentations. Put them in the chat box, and then we hopefully will have a chance to get back to those later. You can direct them to a specific speaker, or you can put a general question there. And I also understand that people can vote for different questions that come up. So without further ado, I would like to welcome Taylor. I would like to give the floor to Taylor and to give her presentation and tell us a bit about what's going on in the region with regards to mainstreaming disability and gender, and why this is so important. Taylor, please go ahead.
Thanks so much, Nike, and really thank you everyone for attending today. As Nike said, this is a really exciting opportunity. It's been a couple years in the making, so we're really happy to formally launch this new curriculum. So first and foremost, I am from UNICEF, but I want to say I'm wearing my ex-advisory group, Transform Advisory Group chair hat on today, because this definitely was a collective exercise, and we had a lot of great inputs from all of our Transform membership in the advisory group. So very first, I'm going to repeat a bit of what Nike said, but I just want to emphasize this was a collective activity. It was coming out of some recommendations from a formative evaluation that was done on Transform in 2019 that said we should be doing more integration of gender across our curriculum. We made a very deliberate decision as the advisory group to integrate both disability and gender across the existing curriculum and those modules that Nike referred to, not to develop standalone modules. And we'll talk a little bit about why that was in future, but I'm sure a lot of you know. As Nike said, we hired Presto to do the work, and just wanted to give some credit to the multi-agency task team that really supported providing both inputs on the work that Presto was doing, but also a lot of really high-level technical expertise to help us to get through it. So just very quickly, why is an inclusive lens important for social protection? We're all looking at this from the lens of Transform, and that means essentially from the capacity and understanding of administrators and practitioners of social protection. And I think we all are very well aware that there's some limited understanding of some of the strategic needs of different vulnerable groups. And unintentionally, this might result in some unintentional barriers to accessing social protection. So the Transform group really thought this was important to make sure that we are trying to build out some of that capacity and helping practitioners to understand it really well so that they want to take action in their own programs and policies at country level. Of course, we also have a growing amount of evidence that demonstrates that social protection has really positive impacts on everyone across the board, but particularly on women, girls, and persons living with disabilities. So we know that just social protection on its own is having that impact, but we think there could be more. And so we wanted to see how we can really integrate a more specific gender lens and disability inclusion to try to capitalize on that impact and really maximize on it. Now, just a quick reminder for everyone, social protection coverage in Africa writ large is still quite low. While it is very popular, and by 2017, every country in Africa did indeed have at least one non-contributory scheme in place, less than 20% of the population is currently covered by one social protection benefit. And that information is coming from ILO's wonderful social protection report that they put out. Now, what about the COVID boom? I know we saw that COVID really had a lot of popularity and attention drawing towards social protection, and it's true. There were so many interventions that had happened during COVID to be able to respond to the economic shock of COVID using social protection. Unfortunately, at least in Africa, we saw most of that boom was temporary, and much of the expanded support and expanded coverage that we saw shrunk after the COVID pandemic subsided. So just really quickly, in terms of what we see about gender responsive social protection, and here I'm focusing on ISAR, which is my region, which is I know more about. We're actually finding that we don't actually have the numbers, right? And there's a lot of reasons for this that we could go into at another time. But just to use as a proxy, in response to the COVID-19 pandemic, all of those social protection measures that were done, only about 20% took gender deliberately into account. And I want to be really clear, I'm not just talking about numbers, I'm not just talking about targeting towards women, but having actual gender principles and objectives integrated into the program. So again, just to say, despite the importance of social protection and how much we know that social protection can impact gender disparities, they're often neglected and not deliberately addressed in social protection. Just to mention, this is a global estimate. UNICEF is putting out a bit more of a detailed review of gender responsive social protection in Africa. That's forthcoming, so please keep an eye out for it. How about disability? So again, I'm focusing on my region that I know well, so Eastern and Southern Africa. We are finding actually there's quite a number of programs that are disability inclusive cash transfers in the region. So you can see just here by the map, we have disability specific schemes. We also have targeted mainstream schemes, and we have some disability relevant mainstream programs. But I want to be really clear, this is similar to the previous slide about the popularity of social protection, the popularity of disability inclusive social protection. It actually, we're finding the coverage is still very, very low. And again, this is coming from the ILO. In Africa, less than 10%, that's less than 1 in 10 working age adults with severe disabilities are actually receiving a disability cash benefit. So while there's will there, while there's a lot of interest, we still have a lot of work to be done. Now let's just talk about why these are important, why these were selected to include in the curriculum. So I won't go into the detailed schematic here. We have an expert that's much more suited to talk to you on that today. But I just want to highlight the key pathways that we're missing if we're not doing a gender responsive lens on social protection. So beyond covering women, beyond the welfare impacts that we can see for women and girls and their partners and their families with inclusive social protection, we're also missing a lot of really underlying issues, structural issues that we could possibly be addressing with social protection, including household decision-making, power dynamics, gender norms, and of course, ensuring that we're investing in human capital in the household. Now, similarly for disability, inclusive social protection, why is that so important? Well, of course, we know that persons with disabilities have a lot more costs, right? They spend more money, both disability-specific expenses to enable them to lead their lives as they would like, but also they have, additional extraordinary costs that we might not think of. So for example, there might not be public transportation that's accessible. So persons with disabilities might have to spend additional money to identify and pay for transportation that can get them to where they need to go. And we know that they also have the potential to earn less. In many of the countries in Africa, there's less employment opportunities, there's fewer educational opportunities, also lower wages and lower income for persons with disabilities. So I'm hoping that we can see as social protection practitioners on this webinar, there are a lot of entry points here where social protection can really take a very profound impact on some of these barriers. But also just to mention that it's not only about, having money accessible to persons with disabilities, but there's a lot of other design and policy choices that could be made to help improve some of these barriers. So very quickly, I just wanted to give a few country examples of where we're making some great progress in these two areas. Again, apologies, I'm focusing on my region, but of course, there's a lot of great examples across the continent. So first, looking at gender responsive social protection, I'm looking towards Ethiopia and the National Productive Safety Net Program. Now, this program has gone through a lot of iterations over the years, but more specifically and more recently, they've been doing a lot of programmatic and policy design choices to help ensure that both women and men are able to benefit equally from the program. So this is a public works program, and obviously with the maternal and childcare responsibilities of female caregivers in Ethiopia, they were found to be excluded unintentionally from accessing the PSNP. So the government has made some variations in terms of the labor requirements and also in terms of intensity and allowing some schedule flexibility for women so that they can still fulfill their childcare responsibilities, but also have access to the program. And there is some evidence here that the PSNP has actually had a lot of really positive impacts on households and also starting to make some movements towards impacts on gender dynamics and gender norms. Now, for the disability inclusive social protection, I just want to give a little preview. I actually had wanted to select Zambia for my example here because they're making such great strides and great work there. But we're privileged to have Dr. Banda from Zambia, so we'll be able to hear a lot more details from her. So I'm going to move over to Madagascar, where there's a universal child benefit called Zara Mira that is also testing out the top of a equal opportunity grant or a disability top up for all UCB household members. So this is looking at adding an additional entitlement that will help cover some of those additional costs that we saw before for persons with disabilities that are living within the UCB household, and that's for both children and adults. And they're also doing a lot of work on updating and ensuring that the data is accurate and that people have access to the services they need, including testing out a community-based disability assessment and update tool that is supported by social workers. And finally, they're working with an organization of persons with disabilities to develop complementary services and also to support with identifying referral pathways to do some of those additional cash plus kind of additional services. So with that, I'm going to move over to Presto or hand over to Presto, who can tell you all how we did the curriculum revision. And I think they'll give a lot of great examples and elaboration as well about the disability and gender inclusion aspects. Thanks so much, Nikkei, and back over to you.
Taylor, for that excellent presentation and introducing really a bit the landscape in Africa, specifically the region that you work in, and why this inclusive lens is so important. What it means to really truly address needs of women and persons with disability, as opposed to simply ensuring that they are covered. I think this is a different thing, and I hope we can discuss this a bit later. But as you said, first let's hear from Tia and Morgan on the work they did for Transform. Over to you, Presto team.
Thank you. Good morning and good afternoon, everyone. Thank you for those introductions. The revisions that we conducted with Presto were overseen, as Taylor mentioned, by an advisory board consisting of multiple agencies. The team making the revisions was led by Maya Gavrilovich and me, with members Morgan Banks, who you'll hear from soon, Nicola Belvin, Lusaja Kajula, with research assistance from Xanthi Hunt and Grasa Marwerwe. The approach that we took to making these revisions of 9 existing modules of Transform was to ensure that the trainings represent best practice principles. So, for example, recommendations under the Joint Statement on Inclusive Social Protection for Persons with Disabilities, led by ILO and the International Disability Alliance. In gender responsive and disability inclusive social protection, we reviewed the evidence on gender, disability, and social protection in Africa and other low and middle income settings. We also interviewed several social protection experts, including master trainers and other scholars on the topic, and incorporated best practice principles as well as short case studies. When we talk about gender responsive social protection, it's important to remember that gender is socially constructed and refers to the socially ascribed roles of girls, boys, men, and women, including norms, behaviors, and roles that are expected of individuals based on their biological sex, which refers to characteristics such as chromosomes and anatomy. So gender inequalities create unequal social and economic systems, which limit women's work opportunities, social status, and control over resources, and also disproportionately burden women and girls with care responsibilities. Along the continuum of gender integration of social protection programming, this can range from gender discriminatory programs as well as gender neutral and gender blind programming, which do no further harm rather than upholding the unequal status quo, all the way to gender transformative programs, which tackle root causes of gender inequality and transform harmful gender norms. Gender responsive programming requires integration of gender considerations into different stages of the design, delivery, and monitoring cycle. And without gender responsive programming, the objectives of reducing poverty, addressing risks and vulnerability, which are often gendered, and providing equitably distributed income security against risks and vulnerabilities are unlikely to be met. In terms of disability inclusive social protection, starting with a definition, so persons with disabilities include those who have long-term physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. People with disabilities face a greater risk of poverty and are also more likely to be excluded, including from work, schooling, and other places, due to overlapping attitudinal, accessibility, financial, and other barriers. Social protection can help reduce poverty and improve participation among people with disability. Importantly, it can address disability-related extra costs, including costs for healthcare, transportation, personal assistance, rehabilitation, and assistive devices. However, systems may not be inclusive of people with disabilities or meet their needs. Disability inclusive social protection is grounded in principles of the UN Convention on the Rights of People with Disability, and it draws on the ILO and International Disability Alliance-led joint statement toward inclusive social protection, supporting full and effective participation, including and inclusion of persons with disability. Disability inclusive social protection needs to keep into account key considerations, including improving accessibility, confronting misconceptions and negative attitudes towards people with disability, ensuring their active inclusion and participation in the design and implementation of social protection, supporting their autonomy and inclusion across processes, and designing programs and monitoring those programs to meet their needs. We're going to present in this presentation very high-level brief examples of some of the edits and key considerations for each of the 9 modules that were edited. So when social security rights of very vulnerable groups are recognized in constitutions and enshrined in laws, this can create the political legitimacy, build societal momentum, and public action to ensure that their rights can be enjoyed in practice. The right to Social Security is explicitly articulated in Article 9 of the International Covenant on Economic, Social, and Cultural Rights. Within this, it states in Article 3 that states are obliged to ensure that women and men can equally enjoy rights to adequate work, social security, and an adequate standard of living without discrimination. The right of people with disability to social protection is further codified in other conventions, such as the Convention on the Rights of Persons with Disability. In turning to selection and identification within social protection programs, there are several problems with poverty targeting versus universal targeting. So, for example, stigma can deepen social marginalization of disadvantaged groups. Poverty assessment is often made at the household rather than the individual level, and this obscures intra-household differences in consumption patterns that tend to disadvantage girls and women as well as people with disability due to their social exclusion and unequal status in the household. Household level poverty targeting rarely accounts for how individual circumstances can affect the standard of living, such as disability-related extra costs, as well as other dimensions of poverty, such as time poverty and unequal unpaid care burdens, health and education deprivations, gender-based violence, and intra-household exclusion from decision-making and resource allocation. Implementation staff and frontline workers working in social protection programs should receive basic training in gender responsive and disability inclusive design and delivery. Information about programs and application procedures should be made available in accessible communication formats, including Braille and other formats. And disability assessments for eligibility are often very complex and time-consuming, and they put undue burden on applicants. For example, seeking medical documentation of impairments from hard-to-reach health centers. In contrast, functioning-based approaches that require less specialized medical expertise are preferred in selection and identification procedures. When we think about administration of programs, it's important to train staff on the motivation behind inclusive design elements to ensure that these programs are being implemented as intended to have maximum benefits on inclusion and gender equality outcomes. In terms of registration efforts, and it's important to target outreach for groups that experience greater barriers than others. So accessibility includes addressing barriers related to physical limitations, accessible technology, and financial inclusion. It's important to ensure that payment distribution methods are accessible. So, for example, ensuring access to financial services where possible can enhance outcomes, including for women and people with disability who may be less likely to have accounts in their name or control over mobile phones in the household. The focus should also be on improving financial services in underdeveloped regions. When we think about exit from programs or so-called graduation, it's important to remember that individuals differ in their capacity to graduate or exit social assistance, whereby they would then need to enter into contributory social protection programs, because as individuals, we do not graduate from the need for social protection, but rather people can move from social assistance into other types of contributory social protection programs. And it's important that there is effective case management for this. But also it's important to recognize that some people with limited productive capacity may not be able to exit some of these social assistance programs, and that, for example, people with disability often require social assistance across the life course to manage the extra costs of disability. The type of support they require may vary by their life stage, as well as their poverty status, to offset both extra costs of disability as well as poverty. Conditions can also be problematic. So, for example, there may be barriers for women, girls, or people with disability to fulfilling conditions. So, for example, if health and education services are inaccessible for people with disability, complying with conditions, including public work requirements, information sessions, and taking children to health checkups often falls to women, reinforcing gender stereotypes of women as caregivers and increasing the unpaid care burden and time poverty of women and girls, and this can counteract program objectives related to women's empowerment. Similarly, people with disability may face additional barriers to meeting the conditions, and so complementary efforts may be needed to remove these barriers, including investing in inclusive health and education systems. In a case study, the government of the United Republic of Tanzania had primarily delivered payments for its productive social safety net program in manual cash since its inception. In 2018, it piloted in 16 different districts e-payments, but prior to further scale up of e-payments, a gender assessment was conducted, which identified major gaps in financial inclusion. Some of these gaps were that less than 70% of women lived in a household with a cell phone, mobile phone money use was more common among men than women, and only 3% of PSSN beneficiaries had a national ID, which is often required to activate a SIM card. However, this has since improved, as in 2020, there was a national rollout of national IDs, and now more than 38% of households receive cash from the PSSN program through e-payments. When coordinating programs, it's important to first map availability and quality of complementary programs and services, and the degree to which these services are both gender responsive as well as disability inclusive. Well-coordinated programs in this way can go beyond a focus on immediate economic and food security and actually facilitate women's and people with disabilities and other vulnerable groups' empowerment, voice, and agency, which can then have transformational effects to sustainably reduce poverty. Case management of different programs requires resources to increase the capacity for referrals, including investing in the social worker workforce, including both capacity related to training and number of social workers. MIS systems can be used to better coordinate among different schemes and institutions, including ensuring interoperability with disability registries. Laws under governance and coordination can be a necessary political commitment and public action to ensure that groups have formal access to entitlements. When programs are not grounded in a legal framework, this creates a significant uncertainty for programs and beneficiaries, as they can be canceled at any time and beneficiaries lack legal recourse to claim their entitlements. It's important that agencies' governance and procedures promote inclusivity and equity. So one of the examples of a place where programs are grounded in a legal framework includes Kenya, which explicitly states commitments on women's and people with disabilities' rights to Social Security in its constitution and sets the basis for specific legal and programmatic interventions. When we think about inclusivity of governance and procedures, this includes including women and people with disabilities, including organizations of people with disabilities as part of governance and coordination structures, and recruiting and supporting staff from vulnerable groups, as well as training staff on key issues of gender, disability, and vulnerability. When we talk about the different dimensions of capacity, for example, at the organizational level, a culture characterized by traditional gender norms and male-dominated workforce can present barriers to the implementation of gender-responsive program features. Similarly, social attitudes that people with disabilities should not or cannot work or cannot manage their own social benefits can lead to paternalistic approaches to social protection that increase dependency rather than empowerment and dignity. In terms of financing, gender budgeting is not a new approach to budgeting, but rather it requires a new explicit recognition of gender at key entry points. It requires an ongoing process of keeping a gender perspective in budget formulation, implementation, and review. Systems can be adapted to output sex disaggregated reporting of end users or recipients of various budget programs. Budgeting should also be compliant with the United Nations Convention on Persons with Disabilities. This includes making sure that resources are allocated to ensure that commitments are kept to increase the focus on disability across programs and policies, and allocating funds to address barriers to participation and well-being faced by people with disability. It also ensures that new spending initiatives do not unintentionally promote exclusion, such as building non-accessible infrastructure, investing in segregated schools, and funds should be mobilized across different sectors rather than to a few specific sectors. It's also important to recognize that women in many settings are employed at higher rates than men in social sectors such as education and health, and thus salary cuts and caps disproportionately hurt women. People with a disability often have greater need for health and social services, and so austerity measures could disproportionately increase their out-of-pocket costs. In a case study for financing in 2019, South Africa's gender responsive budgeting was formalized through the Gender Responsive Planning, Budgeting, Monitoring, Evaluation, and Auditing Framework. Then in July of 2021, the National Treasury collaborated with IMF to apply the IMF's Gender Responsive Budgeting Framework. It was found that in South Africa, several things led to successful gender budgeting, including a multi-layered strategic planning architecture. The country benefits from an effective and respected supreme audit institution and an array of institutions that play important roles across several ministries in the gender budgeting process. Over to Morgan.
Thanks so much, Tia. I'm going to now speak about management and information systems. So a management and information system can perform a variety of functions, such as identifying beneficiaries, ensuring compliance with conditionalities, for redressing grievances, and generating payment lists. It's important that these systems incorporate gender and disability features from the outset. This can ensure that programs are better able to identify eligible recipients with disabilities or women and girls, and improve the outreach and targeting for these groups. It can also assist in providing tailored support for these and other groups, as well as tracking the performance of the program, including the reach and key outcomes. So in order to have an inclusive MIS system, it's important to have data on disability and gender. So sex is a commonly collected data, disability is less so. However, the advent of questions such as the Washington questions, which are 6 questions and relatively quick to ask, can help to improve data on disability in MIS systems. And it's important to both collect this data as well as to disaggregate data by these characteristics. And there could be potentially tailored software applications, such as using dashboards with disaggregated information. Next slide, please. There are several key steps that are important for designing an inclusive MIS system. So importantly, in setting up an MIS, it's important to have a needs assessment, which involves meaningful participation of key civil society groups that represent women and people with disabilities, such as organizations of persons with disabilities and women's groups, so that they can design an MIS program that is responsive to the different needs of this group. Also, when we look at integration of data from across different programs, this can be really important for women and people with disabilities. So women and people with disabilities can experience multiple and overlapping exclusion and risks, and so may benefit from several different social protection programs. So centralized data integration can help to link potentially eligible beneficiaries to different programs that address different needs. Another key feature of an inclusive MIS system is ensuring that there are appropriate safeguards in place to ensure participants' privacy. And it's important that these informed consent procedures are adapted for people with different communication needs. So, for example, for people with disabilities, there may be needs for adapted communication, such as screen reader compatible websites or communication using sign language or Braille. Then next, I will turn to monitoring and evaluation. Next slide, please. So monitoring and evaluation is critical for ensuring the accountability of programs, that they are doing as they are intended, and also to continually improve upon programs so that they are better able to meet the needs of specific groups. In order for monitoring and evaluation to be responsive to the needs of people with disabilities, there needs to be a focus on disability and gender in these approaches. So that goes from both how data is collected as well as how it is disseminated, ensuring that monitoring and evaluation outputs are in user-friendly, accessible formats. Next slide, please. There are several key steps for inclusive monitoring and evaluation. So importantly, again, here it's very important to ensure active partnerships with civil society representatives, organizations of people with disabilities, women's groups, and others, to design appropriate questions to be part of the monitoring and evaluation system and decide on the best methods for how to collect data. Engaging with these groups is also important as they can feed back information to the participants. Staff need training as well on how to have disability and gender awareness when they are doing their evaluations. Next slide, please. One example of some monitoring that focuses on disability comes from South Africa. So here there are disability assessments, and these assessments can be quite complex, and there are sometimes inconsistencies in how they are completed and the ultimate decisions. So to ensure more consistency, a proportion 20% of the decisions are reviewed by medical experts. So they do not change the decision of the implementing body, but they are used to monitor trends in decision making and to ensure regularity in decisions. Next slide, please. So the final component that we looked at is shock responsive social protection. So we are living in a world where there are increasing risk of shocks from climate change, humanitarian crises, and other events. So social protection has a critical role in ensuring that people are protected during these events. Women and people with disabilities are often at an increased risk of negative outcomes from shocks and stresses, as they often have a lower ability to cope with these shocks due to pre-existing poverty as well as discrimination. So programs that are intended to address shocks need to have inclusive criteria to ensure that they are adequately reaching women and girls and people with disabilities, eliminating barriers to registration and considering their increased risk and so increased need for programs. Programs may also need to adapt so that they are adequate for different groups. So for example, people with disabilities may need a higher amount as they are also dealing with extra costs that people without disabilities may not. And it's also to ensure they are comprehensive. So shocks can disrupt a wide array of systems, and these systems may be needed more by certain groups. So for example, health systems that are disrupted during a crisis, such as we saw during COVID-19, can have particular impacts on, say, people with disabilities who tend to have a higher need for health care. Next slide. So we hope that across the different slides that both Tia and I have presented, we have emphasized a number of key points on why a gender and disability lens to social protection across all processes is essential to ensure these groups are not left behind. And all stages of program design and implementation should be informed by detailed gender and disability assessments that involve members of these groups and their representative organizations. It's also important to note that there are many different drivers of exclusion and poverty amongst women and girls and people with disabilities, and social protection programs need to be comprehensive in addressing these different barriers. And across all processes, we must consider accessibility, non-discrimination, and how to best support the autonomy and dignity of women and people with disabilities, as well as other groups that are typically left behind. Thank you very much.
For this very rich presentation. There's so much to unpack here in terms of the considerations when making those policy and implementation choices. And I think, you know, having data and information is really a place to start with, to make those decisions and to keep updating, of course, as you move along and gathering data. And I saw also that Madame Banda made a comment in that regard, and I hope we can address that later in discussion. I think what also really captured me is those interlinkages of the different vulnerabilities between persons with disability and women, and how perhaps when you're a woman with a disability, you're likely to have even bigger challenges in areas of income and accessing cash or accessing services. So yeah, let's talk about that some more. But first, let's go to Agatha, who is the last speaker and will bring us down a bit to the ground and take us to through the Zambian journey to improve specifically her disability inclusion in the social protection system of Zambia. Over to you, Agatha.
Thank you very much, Nikki. So I'm Agatha, as I've been introduced. I work with the Zambia Agency for Persons with Disabilities, which is a quasi-government institution under the Ministry of Community Development and Social Services. So just to give a background of where we are coming from as Zambia, we signed the ratification of the CRPD in May 2008, and in 2010 we proceeded to ratify it, and then we also developed the Persons with Disabilities Act in 2012. So there have also been other legislative changes in Zambia, and the other notable one is the repeal of the Mental Disorder Act of 1949. So we had that repeal in 2019, and then we also saw the development of the National Disability Policy and the Social Protection Policy. So we've also seen some gains in strengthening the social security through what institution is known as the National Pension Scheme Authority and the Workers' Compensation Fund Control Board. So the Workers' Compensation Fund Control Board is responsible for compensating workers in respect of accidents suffered during the course of duty. Then Zambia also has seen the establishment of a number of granted disability service institutions. So one of them is ourselves, the Zambia Agency for Persons with Disabilities. We are the ones that are mandated to register persons with disabilities in Zambia. And we also regulate, inspect, and coordinate services for persons with disabilities in Zambia. We also have the National Trust Fund for Persons with Disabilities. They are the ones that are responsible for providing financial skills literacy for persons with disabilities. They also issue out small loans as capital, startup capital to persons with disabilities in entrepreneurship businesses. We also have the National Vocational and Rehabilitation Center. This is a rehabilitation center as well as a training institution for persons with disabilities. in different fields. And then we have the Zambia Library and Culture Center for the Blind. It's a rehabilitation center for the blind and those that acquire visual disability. So when it comes to the cash assistance program, the Section 36 of the Persons with Disabilities Act, number 6 of 2012, provides that the minister, in consultation with the minister who is responsible for labor, they're supposed to ensure and promote the rights of persons with disabilities to social protection and an adequate standard of living to improve their well-being. Then the Act also goes on further to provide that access by persons with disabilities, especially women and girls with disabilities, to social protection programs and poverty reduction programs. These have to be spearheaded and put, given the emphasis that they deserve, because like other speakers have mentioned, women and girls with disabilities face greater challenges as compared to the male counterparts. So there's a deliberate effort to actually take the issues concerning women and girls with disabilities at the center stage. Then the biggest social protection cash assistance program in Zambia is what is known as the Social Cash Transfer Program. It's administered by the Ministry of Community Development and Social Services. Yes, please.
Sorry to interrupt you. Could you please guide us with the slides by saying next?
Sorry.
We keep up with you. No problem.
Sorry. Okay.
No worries.
So where am I? I think you've gone ahead. You are ahead in what you are showing. I'm a little bit behind. Okay, I've passed disability service institutions. I'm on the cash assistance program and the next slide. So the next slide. Okay. So I was just saying that the major cash assistance program in Zambia is what is referred to as the Social Cash Transfer Program. And this is administered by the Ministry of Community Development and Social Services. And they've been doing this since 2003. So the program itself, the nature of the program is that previously we saw a few numbers of households that were under the program. And I wish to mention that the program itself does not target individuals, but households. So for example, in 2018, we had about 632 households on the program. But we have seen an increase since then, and currently we have over 1 million households on the program. And for persons with disabilities, households with persons with disabilities, they represent about 23.43% of the total. So which gives us somewhere around 307,000 households. So you can proceed to the next. Okay. So we've also seen some shifts in the way the program is being administered. And one of the shifts is that previously emphasis was placed on one having a severe disability as a criteria for selection. But with the concerns that were raised from persons with disabilities themselves, the organizations of persons with disabilities, this was changed, and now the program allows for those with moderate disability to be also considered. Then in terms of the payment amounts, persons with disabilities on the program receive double the amount compared to those without disabilities. So in kwacha equivalent is about 800 kwacha. So this amount is paid bi-monthly. And then there are different payment methods. There are those who are still receiving the funds at cash point. So where we have the social welfare officer going out into the community and giving out the funds bi-monthly. Then we also have those that receive the money through electronic and through the phones. But of course, the different payment methods are also presenting their own challenges. And Zambia is still trying to find that reasonable, I don't want to say perfect method, because I don't think there's one perfect method, but something that can accommodate the concerns of all disability types. Then we also have the grievance mechanisms that has increased the disability inclusion. Okay, the next slide, please. Okay. So what are some of the drivers of change that we can attribute to Zambia's case? And one of them, I think the strongest drivers of change is an increased and strong OPD voice advocating for the rights of persons with disabilities in Zambia. Just a few examples of organizations of persons with disabilities. They include the Zambia Federation of Disability Organizations. This is an umbrella body. And then we also have the Disability Rights Watch. And then we also have the Mental Health Users Network. I think these are three notable OPDs that have really made an impact when it comes to promoting the rights of persons with disabilities. And then we have others also that represent persons with albinism as well, such as the Albinism Foundation of Zambia. So we've also seen that the social cash transfer program has managed at least to make a difference in the lives of persons with disabilities. And we have some stories of change that we're able to see, but that doesn't mean that the program itself is perfect. Concerns are still being raised by persons with disabilities. The next slide, please. Okay, so on the gaps and opportunities, they mentioned the introduction of payments through mobile phones. And then we also, one of the gaps that we have is the gap as an agency. Mentioned that we register persons with disabilities. We are the ones mandated to register persons with disabilities. But if we compare the number that we have registered against the prevalence that is there in Zambia, we are still far away as an agency. So there's a huge gap between what we have in our disability management information system versus the prevalence. So we are the ones, again, who issue these disability cards. And one of the criteria for one to receive that double payment on the social cash transfer is that they must have this card, which is issued by us. So already it brings a lot of a challenge for those who are not able to access the cards, because ZAPID is not present in all the Zambia's districts. Then we also have the gap in terms of human resource for disability programming I think there's a lot of need, a huge need for investment in human resource development. And we also have several programs that are not aligned with the human rights approach and still using the charity model where persons with disabilities are seen as the recipients of care and people that are not able to contribute effectively to their own lives and need handouts. So we still are grappling as a country to move and shift towards the human rights approach. Okay, the next slide, please. I heard one speaker mention the issue of the accurate data and statistics. Even ourselves as a nation, we have that challenge, and there's a lot of opportunity around that. So the 2000 national census for Zambia reported the national disability prevalence of less than 2%. And then we had the first national disability survey in 2015. This approximated the prevalence at 7%. And in 2022, we had the national census. The national census puts Zambia's population at slightly above 19 million, but unfortunately, we have not received the statistics for the prevalence of persons with disabilities. So those are some of the gaps that we continue to experience, and it still poses a challenge for us as an agency to receive statistics from service providers, whether in the public or the private sector, in terms of the services, social protection services that are being provided to persons with disabilities. So there's need for measures to ensure that persons with disabilities have access to education, to empowerment and social services. Then we also have experienced a weak OPD movement. And I know this may sound like a contradiction to what I'd said earlier, but it's not. This is in reference to representation of those with psychosocial disabilities. We see that they are underrepresented, and then they are sometimes overshadowed by the key main disability types. So there's a weak representation and movement in that sphere. So basically, this is where my presentation ends. I just wish to say that, yes, as a nation, we have made strides, but there's still room for improvements. Though we have the social cash transfer program, where persons with disabilities are receiving the double payment, we still have an outcry from persons with disabilities who would prefer to have an allowance as opposed to this cash payment, because their justification is that payment should not be based on vulnerability, but on the fact that every person with disabilities incurs additional costs by virtue of them having that disability. So the payments should be across the board and should come as a form of an allowance and not as what is currently being done. Thank you, Nikki.
So much, Agatha, for taking us through Zambia's journey, and very inspiring, I think, for a lot of other countries, even though we also recognize that there's still gaps and challenges. And I'm curious to know, from the audience, and I see already a lot of remarks in the Q&A, how they see Zambia. I see that there's a couple of questions directly related to your presentation, and we will come to them. We have about 20 minutes for Q&A. So I'm looking at the questions and trying to bring some of them together and see who to ask them to. I think one of the first ones that asked the question was Portia and as well as Munga. And I think these questions are probably directed to Presto. So either Tia or Morgan. Portia is asking, are there any insights on how social protection is doing in tackling intersectional discrimination and multidimensional vulnerabilities for both women and persons with disability? And how social protection programming can be improved to address these? And Munga is asking, and how can we promote the inclusion of persons with invisible disabilities? We haven't really discussed the diversity in persons with disability, and this is something that that's often much more of a challenge in terms of getting registration, getting recognition for your disability. Can I ask you to take the floor for these questions, Tia or Morgan?
Sure. Why don't I start off with the disability related angle? So looking first at the question of being able to identify people with invisible disabilities, this is definitely a challenge across social protection programs globally. And part of it comes down to the training of people that are doing the assessments so that they have a broad definition of disability, and that goes beyond disabilities that are more apparent, such as a physical disability or a severe intellectual disability. So training is definitely a key component. Another component is unfortunately for a lot of invisible disabilities, there's currently a reliance on medical documentation, for example, showing the presence of a psychosocial disability. So that may still be necessary while we get tools in order to identify that at a more functionally based approach. But people should be supported in the costs of seeking that medical documentation so it doesn't pose as much of a burden on the individual. Then there was a question about social protection addressing intersectional either discrimination or other types of exclusion. With one note on discrimination, I think this is something that needs to come through a bit more sometimes, as social protection can sometimes reinforce negative stereotypes of disability, such as that people with disabilities are unable to work or cannot manage their own funds, as Tia mentioned. So broader sensitization is really important to ensure that it's clear the purpose of social protection and why people with disabilities may require more different types of social protection, but so it's not unintentionally leading to increased discrimination, particularly in communities where many people might be living in poverty, for example. And then in terms of different barriers to participation and improved livelihoods, I think the stronger social protection programs are ones that take a multi-pronged approach. So they may involve a cash transfer with access to health benefits, as well as programs for improving livelihoods. So I think a key message is really that a cash transfer can be very important and essential, but it's rarely sufficient. So diverse social protection programming is the way forward. Tia, I'm not sure if there's anything you want to add from the gender side.
Yeah, just to add that there's recently been a review on impacts of social assistance programs, specifically within social protection globally, which looked at over 100 publications across 42 lower and middle income countries. And they found that social safety nets had positive impacts on both women's economic achievement, but also on their agency. There was some very interesting findings with respect to conditions, and they actually found that unconditional cash transfer programs had much larger significant impacts on economic achievement and agency, whereas conditional cash transfer programs only had smaller effects, and in a meta-analysis, these were not statistically significant. So it goes back to that idea of measuring outcomes related to gender and disability, it's important not only that we implement these in inclusive manners, design and implement them inclusively, but also measure the impacts that they're having on women, girls, and people with disability, and really thinking through some of these design characteristics and how they might be either supporting program objectives, or in the case of conditions, might they actually be working counterproductively against objectives around women's empowerment.
Both very good insights, and I think the next question relates to this in a sense that, okay, thinking through, you know, the different mechanisms and considerations in social protection, you have to also take into account the bigger picture in terms of the interconnectedness with other sectors. So the LEAP, for example, is asking, given the connected nature between social protection, health, education, and economic development, how can African governments adopt a more holistic and integrated approach to policy making and service delivery to ensure that the needs of vulnerable populations, including women and persons with disability, are adequately addressed? What institutional platforms or mechanisms exist to facilitate cross-sectoral collaboration and coordination at the national and regional levels? And I want to connect to this question, the one from Nuruddin that came early on and saying, we know that social protection coverage is low, so we need to invest more by mobilizing funds. But the problem, one of the problems is political will. And his second question relates again to looking at the bigger picture of vulnerabilities across society, not just for women and persons with disability, but also young people, migrants, etc. This is a bit of a big one, but I wanted to ask Taylor as well as Agatha to reflect on this. So thinking about the different vulnerabilities in society and thinking about the different sectors that work to address those, what are some of the entry points that you see or you have seen in your experience in Zambia and in the region that work towards accelerating, addressing these vulnerabilities or lack of income?
Okay. Thank you, Nike.
Agatha, please come in.
Oh, sorry. Thank you. I would like to just give the Zambian perspective. We have coordination mechanisms as Zambia. Okay. So we have coordination mechanisms in Zambia that start all the way from the sub-district level through the decentralization policy. And personally, I feel that it's an opportunity that Zambia can actually utilize to increase the voice of persons with disabilities if representation is made available for them to be present on those platforms. Then, because Zambia is currently undergoing the decentralization process, we have what is known as the Constituency Development Fund. And each constituency in Zambia has an allocation of resources. And it's an opportunity for persons with disabilities to also tap into those resources. But unfortunately, because of underrepresentation, we have not seen them taking full advantage of these resources. But the opportunity is there. We require a lot of awareness raising programs, not just for persons with disabilities, but also for those that actually allocate these resources and administer these resources at the different levels. So I think that's what I can comment on about the Zambian perspective.
Thanks so much for the question. Yeah, I was actually just typing a response in the Q&A. Look, we look at social protection from the perspective of usually of addressing monetary poverty, but also, of course, as the discussion has alluded to, it actually has quite a bit of impact on multidimensional poverty, right, or deprivational poverty. And so UNICEF has been working with several governments in the region about doing, trying to identify some links, what we call Cash Plus. So linking the national social protection programs with other key sectoral services and information that might be available at community or local level. Now, I will admit that most of the attention and progress thus far has been made around linking social protection cash transfers with nutrition. And that can be both nutrition services, nutrition information, and nutrition screening and referral. But we are starting to see some expansion towards social care and welfare services, as well as presented today by our colleague from Zambia and the example I provided in Madagascar, looking at opportunities to link in with organizations of persons with disabilities to find access to both services and referrals to available services for persons on social protection cash transfer programs. So it is I don't want to say nascent because it has been ongoing for a couple of years, but in terms of at national scale, we're still making some progress there. Perhaps Tia could also mention, she was the lead on a study in Tanzania that was a Cash Plus program looking at trying to link adolescents in the National Social Protection Program with some other additional services. Now, one last point, sorry, before I hand back, most of this work is being done kind of at the programmatic stage or in the programmatic level, but there are some countries such as Malawi who are also looking up at the policy level and trying to identify, joint objectives and joint policy mechanisms where they can do stronger linkages, from that level as well. And Malawi, it's nutrition and social protection. So definitely can provide some additional resources and more information there. Thanks, and over.
Taylor. Tia, do you want to speak a bit to the Tanzanian example?
Yeah, so for example, in Tanzania, one of the innovations is that it was linking the productive social safety net led by government to existing government health facilities. So adolescents in PSSN households were being provided with additional training as well as mentoring and linkages to existing government health services. Simultaneously, the Ministry of Health worked with facilities and communities receiving this Cash Plus programming to strengthen the adolescent friendliness of the government health facilities. So you had two different sectors working together and supply side strengthening at the same time. I also see that our colleague from Ghana, Mautar, is on the chat, and Ghana has a really interesting example of Cash Plus programming where there was a memorandum of understanding between the Ministry of Health as well as the ministry that was implementing the cash transfer program. So that was another very strong example of intersectoral linkages, linking the anti-poverty cash transfer program with a waiver for the premium to pay for health insurance. So it helped people in the program access other services, including health, through very intentional design components and then linkages across sectors. Over.
Thanks so much, everyone. I saw an interesting question coming from a different region, the Sahel region, from Maiga, and he said he has done research on social registries in the Sahel region, and none of these social registries were using the Washington Group short set in their questionnaires. What are your experiences regarding that, and what can we do? No one has talked about this fact yet, identifying persons with disability. And I think actually Agatha mentioned this in her presentation in terms of data. So different ways of collecting data exist to determine whether someone has a disability or not, and that might have big consequences for whether you are included in social protection schemes or you will be a recipient for other services. I think this question, I mean, maybe Tia, you can answer, and I think Agatha will also have something to say on this one. Over.
Maybe Agatha can come in first.
Thank you, Tia. So as Zambia, in terms of the registration of persons with disabilities, and even registration on the social cash transfer program that I'd mentioned, we are still using the medical assessment tool. But the ZAMStats, which is the National Statistics Agency for us, has used the Washington group of questions during the 2015 Disability Survey and the 2022 National Census. And as an agency, we are currently working with UNICEF to actually see how we can harmonize the different tools that are being used in the country so that persons with disabilities are not overwhelmed with having to undergo different assessments depending on who's providing the social protection service at that particular time. So there is some progress towards moving towards the functional assessment tool, but it's still in progress. Thank you.
Great, and that's really interesting. And then if I could jump in, it's I think there is an issue with a lot of social registries in that they're often based on having an official certification of disability, and that the proportion of people with disabilities that have that official certification can be very, very low. And so depending on the purpose of the social registry, having additional measures of disability can get a wider group who may benefit. They may not be eligible, for example, for a cash transfer, but may need support in, say, an emergency or a disaster. So thinking through a bit, what is the purpose of the social registry and what additional data on disability, whether it's the Washington group combined with disability card certification or other measures. And I think it's an area where it needs further research on the most effective way to do this. And I know this is a priority for UNICEF and other disability-focused organizations like HI and CBM.
If I can also just jump in really quick here, Nike. Indeed, we've had this conversation in a few countries, and the Washington group questions, whether the short set or the full set, they require an extensive amount of training and expertise to be able to administer accurately. And I think that's one of the big limitations for countries that do want to include them, either as part of their registry, excuse me, or as part of their general data collection for targeting for social protection programs. And they find that to be quite limiting and not really a scalable, sustainable solution. Now, there are a few countries like Agatha had mentioned in Zambia, Kenya as well, where they're trying to identify ways to link the MIS or the registry for the social protection programs with a national disability MIS or disability registry of some sort, which is hopefully helping to progress that forward. But again, oftentimes the assessment is based on a medical model. And just to elaborate a bit more on the Madagascar example that I gave, they're actually testing or piloting a community assessment tool that is based more on a functional analysis. And this is being done by social workers and community volunteers to help update and keep the registry active and updated. So it's not only looking at disability status, but other factors as well to try to make sure that the registry maintains its accuracy. Now, it's still very early stages there, so we will be happy to report back and see how well that works and if that is a possible solution to including more of this kind of information in registries. Thanks.
Everyone, I'm looking at the time and I see we have 1 minute left. So I'm really afraid that we have to round up now, even though I know some questions are not answered. I hope that Tumelo's and Fazli's question that were both also on data and registration were answered just now. There's a couple of questions on Zambia. I'm happy, to take those questions or pass them on to Agatha after the webinar is ended. My email address is found on our website, transformsp.org, where you can also find the updated materials. So please have a look. On an ending note, thank you so much, the audience, for your amazing questions, your input. Of course, our speakers for sharing their experiences. Tia, Morgan, your research it's been so helpful for us and for our community. Taylor for being there and driving that process at the time. And Agatha for coming in and really sharing Zambia's story. And I can see, that it has sparked already a lot of interest and discussion from the community here. I think the webinar has shown in general, there's a lot of potential to improve our systems in the region. And there is a lot of, maybe not, always easy and quick fixes, but it's very doable, and we don't need a lot of budget for this. We just need to keep progressively thinking about making our systems more inclusive and gathering the data needed, ensuring our interoperability between the different data systems, ensuring that we are mindful of the different vulnerabilities that span across those groups, and make sure that we coordinate between different institutions to enable women and persons with disability to have access to the services and the income that they need. So within Transform, we will continue to, push for this, promote this topic in our trainings, in our communication. We look forward, to having these partnerships with you in the field, or our ongoing partnerships. But yeah, on this note, I really want to say thank you so much for joining, and we see you again in the next exchange. Thanks so much.
Thank you.
Thank you and goodbye.